Good afternoon. Today we are going to talk about rheumatoid arthritis. Many people associate rheumatoid arthritis with older people, but I, being 21, am here to tell you that that is not always the case. The disease is very common in older people, but young adults like myself and even babies can also have the disease. According to Healthline, 41 out of every 100,000 patients are diagnosed with rheumatoid arthritis every year. This leads to about 1.3 million Americans having rheumatoid arthritis. Our statistics show that women are 2.5 more times likely to get the disease than men. Currently, physicians nor scientists have been able to reach a cure for rheumatoid arthritis. I do not have any type of medical degree, but I do personally have this disease, so I believe that is worth something. I was diagnosed with rheumatoid arthritis at the age of 17. My doctor began immediate treatment, and I'm now able to participate in many activities without any pain that I wasn't able to before. Although being 17, that usually didn't stop me in participating in them. Rheumatoid arthritis is a very serious disease, and it is imperative to have medical treatment immediately. There are many areas that we can discuss about rheumatoid arthritis, but having the disease, I chose 4 that I believe are very important for everyone to know about. We're going to talk about the diagnosis of rheumatoid arthritis, the effects on your immune system, inflammation, and the potential loss of function with your joints, as well as the potential deformation of your joints. First and foremost, we're going to talk about the diagnosis. Rheumatoid arthritis is very difficult to diagnose because there is no one test that clearly states that the patient does or does not have rheumatoid arthritis. The physician must look very carefully and assess the patient and the patient's situation in order to diagnose. The American College of Rheumatology has a list of 7 symptoms, which is on your handout that I've given you, that the doctor must go through to see if the patient has. The patient has to have at least 4 of the symptoms in order to be diagnosed. Not only that, the first 4 in the list have to be present for at least 6 weeks in order to be diagnosed. The doctor has to be very thorough in diagnosing, as if a patient is misdiagnosed, it can be very dangerous to their health. The medications that are used to treat arthritis are very powerful and have very dangerous side effects. Once diagnosed, there are many other things that come along with arthritis. First, about the immune system. Rheumatoid arthritis is an autoimmune disease, which means that your body sees your healthy cells as bad cells and seeks to take them out. It sees them as invaders and wants to destroy them. Normally, your body would seek to destroy things like bacteria and viruses that tend to make you sick. So here, specifically in rheumatoid arthritis, it attacks your joints. This attack of the joints can cause inflammation and loss of function of your joints and the deformation, but we're going to take a closer look at those in a minute. Another thing to take into consideration with rheumatoid arthritis is that the medications that are used to lower the symptoms also can lower your immune system. That just means that patients are easier to get sick when they are exposed to germs. One of the most obvious symptoms of rheumatoid arthritis is inflammation, which is a direct effect of the immune system attacking your joints. The immune system will attack any joint. It doesn't pick a certain one, it attacks whichever one it wants and continues to attack it. So that inflammation can occur in any joint. A lot of times the inflammation does not stop in the joints. It can go on to affect your organs such as eyes, lungs, and even your heart. Research shows that patients with rheumatoid arthritis are more prone to have a heart attack, which is another reason that it is so imperative to know about this disease if you have it. Most patients, including myself, that have rheumatoid arthritis are put on an anti-inflammatory, and this medication just as the name says, and helps to prevent the inflammation. Last but not least, we are going to talk about the potential loss of function and the potential deformation of your joints if it's not treated properly. The potential loss of any joint, because like I said, the immune system will attack any joint, so you can lose the function in anything, and you can also have the potential for the joints to deform. The most common deformation is in the hands, and your hands will start turning in towards your body. So as we see from that, the deformation is visible on the inside of your body as well as the outside. So, as well as it can affect any joint, it doesn't stop anywhere. But there are preventative measures that can be taken. So if you believe that you have any of these symptoms that we've discussed today, you should contact a doctor immediately. Hopefully this helped you to learn just a little bit more about rheumatoid arthritis and the importance of knowing about the disease and seeking medical attention. We discussed 4 different aspects of rheumatoid arthritis. We discussed the diagnosis, the importance of being diagnosed correctly, and the imperative need to seek medical attention and the correct medical attention. We also talked about the root of the symptoms being the immune system attacking your healthy cells because they see them as invaders and want to destroy them. Also, with the inflammation and loss of function and deformation of joints being as well a direct effect of the immune system attacking these cells. Hopefully what we've talked about today did not scare you. My only intent was to inform you about this disease and the importance of seeking correct medical attention in order for you to know about this disease. I really hope that if you believe that you have this disease after what we've discussed today, that you seek out a rheumatologist and allow them to either confirm or deny your suspicions. Also, make sure that you continue to learn more about the disease and discuss any concerns with your doctor, because after all, that's what they're there for.